Hi, I'm Dr. Neel Shah, and welcome to the DBT Podcast.
You ready?
I'm going to do a little intro, okay?
Yeah, for sure.
All right.
Yeah,
Tell me when you're ready.
go for it.
Welcome to the DBT Podcast. I know you were expecting Dr. Neel Shah. I'm a guest host today. My name is just Neel Shah, a lifelong Lions fan, and I'm going to be interviewing Dr. Neel Shah. He's a hematologist, oncologist. He's been taking care of cancer patients for over 15 years and have some very important questions to ask him. So let's kick off this special episode with your guest host, Neel Shah. Dr. Shah, welcome to the podcast. Hey, Neel, thanks for having me. I really appreciate you having me on and asked me to be here. I see your hat there. You're a Detroit Lions fan. I'm also a Detroit Lions fan. I lived in the suburb of Detroit growing up and then lived in downtown Detroit for a few years. That's where I went to school. And so, I think certainly the grit of Detroit, I think, has shaped me and, helped me be passionate about what I do. And I think we're both passionate about the Detroit Lions. So I think, thanks again for having me and ask me any questions you like. I know you have a tough job talking about cancer to people, and I want to see, how do you explain the diagnosis of cancer? What does it mean when you tell someone that they have that or they might have that? Cancer kind of gets grouped into this one thing, and it's actually, there's over 200 different types of cancer, and so it really, we've learned a lot from 50 years ago about defining those cancers, and the way that we do that is there are doctors called pathologists. They look under a microscope when you do a biopsy. So something can look like cancer, or even blood work you do can look like cancer, but until we have a biopsy or some specific test that tells us exactly what it is, because we understand now as human beings, like we can accurately diagnose, treat all the different types of cancer. So it's really just getting the proper tests and seeing, the right doctor to get those tests to be 100% sure about, exactly what's going on. I think it's really amazing what scientists have done, especially over the last 50 years, to figure out that now there's over 200 different cancers. And we used to have only 30 cancer treatments, mainly chemotherapy, and now, we have over 300 drugs. So that can target and treat cancer. So it's really exciting time to do what I do. Of just some of the drugs, because I've been doing this 13, 14 years, most of the drugs I use are new. So I have as much experience as anyone in the country at giving them because, they came out during the time that I've been practicing. So really amazing to do what I do. So I think I got off topic a little bit. In terms of diagnosis of cancer, generally it depends on what type of cancer you're talking about or dealing with. But, getting a biopsy is a first step to defining that. So, Dr. Shah, when someone has the unfortunate diagnosis of cancer, how are you able to tell what the expected course of therapy will be? How do you know they're going to be okay? So that's a great question, Neel. The course of someone's cancer will really depend on what they have. So someone that has a chronic form of leukemia would have a different course than someone that has pancreatic cancer. So it really depends. And so I think seeing if there is a suspicion for a blood problem or cancer in the body, whether it be in the blood or in the body, I think it's really important to see an oncologist. Now, there are certain types of cancers that other doctors can treat that I don't see. So, for example, very early stage prostate cancer, skin cancer. We can unfortunately form cancer really in any part of our body. But as I was saying earlier, we really understand it a whole lot better. So it really depends on, what we're talking about. But deaths are down 30% over the last, since the year 2000. And so I think, we're getting better at catching it early, knowing exactly what it is, and having better treatments. Well, Dr. Shah, now that you've told me that there's lots of different forms of cancer and a lot of different reasons that they can form, what tools are you using that you weren't using 10, 15 years ago to diagnose, treat, stage different cancers? I I kind of feel like people are still dying from cancer. How are you going to fix that? Well, the aggressiveness of any cancer, whether it's skin, prostate, or lung, breast, some of that depends on the pathology. So we understand biologically that certain types, for example, of lung cancer are more not as aggressive, where certain types of um, breast cancer are very aggressive. So we understand by the biology of the tumor, and that's why getting all these tests is so important because it helps us be more certain about what the best um, uh, treatment is, but also like what's the prognosis and time course. So it really depends on the tests. Well, Dr. Shah, I'm sorry to hear that people still need chemotherapy, but I'm glad there's less people that need it. Like, what are the new treatments that you're using to help patients control or get rid of their cancer? So the treatments have dramatically changed from 50 years ago. We were just discovering that chemotherapy worked, but of course, chemotherapy not only kills cancer cells, but also kills other fastly dividing cells in the body. So that's why people lose their hair, because hair is where our cells are fastly dividing. We all have bacteria in our skin, in our gastrointestinal tract. It's constantly getting into our bloodstream. Our white cells are able to fight off infections, but unfortunately, chemotherapy knocks down those fastly dividing cells in our bone marrow. So, our bone marrow is like a factory where all the cells are made, the white, the red, and the platelet. The white helps us fight off infection. The red carries oxygen throughout the body in a molecule called hemoglobin. That hemoglobin is made of iron. And platelets, when we get cut, help us to stop from bleeding. So that's the factory where the cells are made. And that factory is constantly churning out those cells. So that's why when you get chemotherapy, the blood counts can get a little low. And if they do get low, you're at risk for infection, could be at risk for bleeding, or severe anemia, which could lead to fatigue, tiredness, short of breath. Thankfully, I'm using less and less chemotherapy to treat patients. We have more and more targeted therapies. And although any drug you take can have a side effect, we're just seeing less and less of using these more toxic drugs that have been around for a long time. And thankfully, I'm really proud to be part of even clinical trials to bring more and more of those immunotherapy and targeted therapies. And we learned a while back that the immune system is actually a surveillance for cancer cells. So it actually is able to detect and destroy cancer cells. And when I talk to patients, I tell them, in some cancers that it's sending out a signal on the surface of the cancer cell that, hey, immune system, I'm okay to be here, leave me alone. But if we can somehow block that signal, then our own immune system will destroy the cancer. And so, that's where there are immunotherapy drugs that can treat cancer. Unfortunately, the immune system can sometimes get confused. I mean, it happens in a lot of autoimmune diseases, like lupus and other diseases. So when the immune system gets confused, it can attack any organ in the body. So although immunotherapy is a potent weapon against cancer, it can also have some side effects. So really, understanding and knowing how to deal with those side effects is really important. Well, Dr. Shah, I just saw on TikTok that there are people that are taking a lot of supplements to fight cancer or to stop it from happening. Are you recommending any supplements for your patients? All right, that's a common question I get. Should I take all these vitamins or supplements and I'll say that I think there's a few things that I think I would take, but not, there's some other things that I'd say I'd avoid. So I think taking a vitamin D supplement, I think probably is good for everybody. Most of us, especially here in the Midwest, are low on vitamin D. There's some data on prevention and even cancer survivors of having appropriate amounts of vitamin D. So I think vitamin D supplement can be very valuable. And a multivitamin once a day, I don't think it'll hurt you. I don't think there's great data to say it'll help you. Eating a clean, balanced diet with whole foods, I think, is probably your best helpful partner in treating cancer, but also just making you feel good and be healthy. But as far as a lot of other non-tested supplements, I haven't seen much evidence that they're any good. Now, some chemotherapies, they can deplete some of your vitamin stores. So, for example, there's one that we use in lung cancer where someone should take some folic acid every day. So, I think it's an important question to ask. But I think heavy doses of vitamins is not going to help you in the long run. And what I mean by that is there's been studies where they gave someone heavy doses of vitamin C or E, and they didn't really help slow down any cancer. So people have tried it in the past. So I think seeing your doctor is the most important thing. But personally, I don't recommend heavy doses of over-the-counter supplements, including turmeric or ginger, any of those things. I'm not saying don't take those things in moderation, but I think whole foods is just much better than taking heavy doses of supplements. Well, Dr. Shah, I've heard you're a very good doctor, but is there times where you do recommend a second opinion to someone, even if they're seeing you and they really want to get treated by you? So, a second opinion, it's a good question. We see a lot of places advertise for a second opinion. I personally think that it is a good idea if you've seen someone and you just want to get a second opinion, just hear it from someone else. I understand that completely. If you feel completely comfortable seeing your doctor and you have 100% trust in them, and, obviously now there's information available online, I think you should move forward and not waste your time. If you have something rare, I do think that you should maybe see someone that's really specialized in something. So, for example, I treat all types of cancer, including sarcoma, which is a rare form of soft tissue cancer. And if there is a more complicated diagnosis than I have experienced seeing, because I see such a high volume of patients, then I will get a subspecialist, sub-expert involved in conference. It's so easy nowadays to text, call, share information. So I don't think there's really an excuse. One pet peeve that I don't like amongst my colleagues is, faxing things or have your doctor call me or whatever. But you can just text, and so luckily, in the area that I practice in, we all text each other. There's a secure texting system. So when I have a complicated case, luckily, my colleagues are from all different places, reputable universities, and I'm able to put something on a chat and we can all talk about, what the best thing for the patient is. Dr. Shah, I'm sure you get asked this all the time, but if you were in my position or had a family member in my position, are there any mental health support things that you focus on in terms of helping patients deal with their conditions? What would you focus on in terms of their treatment and taking care of them? So I think this is a great question because I think anyone would be shaken with a cancer diagnosis. If it happens to me, I will be too. And I would say that I think I've incorporated some meditation support. I think support groups are great. I encourage when I see a new patient to have some family with them. I think things are easier to go through with other people that love you around you. So I think that helps your mental health. If you don't have someone, then I think, a support group with other people going through the same thing. I know it's helped some family members of mine that have gone through, different types of cancer. So I think those are really helpful. But yeah, I think those are the main things, whether it's prayer, meditation, and being around people that are going to be supportive. I think those are really helpful in your journey. Dr. Shah, are you ever having family get tested for anything if they've been diagnosed with cancer? So yeah, unfortunately, as we've discussed in prior podcast episodes, our genes, we can't always outrun our genes. So we can't always understand why we got cancer. In fact, half the time we don't really know. People feel, unfortunately, I understand that. We always think as humans that cause equals effect. I must have done something wrong to get this. I don't think that's true. I really think that, unfortunately, the way that we're designed, unfortunately, 1 out of 2 to 1 out of 3 of us will get some form of cancer. And unfortunately, sometimes that form of cancer can be really aggressive. About half the time, we don't really identify a cause. Obviously, the most obvious one would be, smoking, leading to lung cancer, or having a prostate giving you a higher risk of getting prostate cancer. So there are some cancers we can completely eliminate. by quitting a habit like smoking, but there are others that we'll never know. Right now, we don't. I shouldn't say we never, but we just don't know why. Someone that's never had a family history, never smoked, prays every day, eats proper diet, and they still get some bad form of cancer. I have multiple patients in my practice. It's really scary, that can happen to someone. But, I think sometimes we're just dealt a bad hand, and we just got to try to deal with it best that we can. I personally have increased the amount of genetic testing I'm doing in my patients. So whether it's seeing a genetic counselor, seeing someone online, there's online services that do that, or getting testing through your oncologist, where that can be done. I mean, the most common thing we think of is the BRCA1, BRCA2 mutation, just for breast cancer and ovarian cancer. It's you can get a blood test. There are now companies that do full gene panel tests. So I think it's an important component to see if there's something in your genes that maybe is predisposing you to something. Finally, why are you so short? Yeah, so I'm glad you brought up this thing about my height. My little brother is 6'1", and my cousins, who are some of my best friends, are also 6 feet and taller. So when we take pictures, it's pretty painful to see. It's right out there for me, but your genes are your genes, So, luckily I'm able to beat all my cousins at pretty much any sport. And they all know that I'm much physically stronger than them. So that gets me through the day. I'm okay being short as long as those other things are up there. So, but again, thanks for having me. Well, thank you for listening to this episode. Dr. Shah, thank you for being here today. I have a gift for you, and I know we're both Lions fans, and hopefully Aiden Hutchinson has 30 sacks this year and eats Bears, Packers, and Lions for breakfast. So thank you, everyone, for tuning in today.